Ashley is full of stars, stripes, and spectacular home savings. Give each room of your home a summer refresh and save 20 to 50% off. Plus, get 5 years no-interest financing with no minimum purchase. Start the best rest of your life with Purple Mattress and save up to $500 off select adjustable sets. Plus, get 15% off Purple accessories. Find spectacular home styles with stars and stripes savings. Happening now at Ashley. Financing is available with approved credit on qualifying purchases. Ask store for details.
We will meet you where you are, ladies. Welcome to episode 10, The Many Hats of Nursing.
Every detail matters.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
This was really thrilling for me to be able to sit down with Kecia Lund, the Director of Nursing, because she is such a high-level labor and delivery nurse who decided she was going to cast her net wider to cover 3 departments in a leadership role to take on Director of Nursing at Essentia Health here in Fargo. And we're going to get into all of the ways she juggles the big renovation and all the changes that happened over the last few years to the Essentia Birth Center, the NICU, and women's services, but then also the day-to-day in nursing. And I am convinced if you were to find a picture next to the definition of busy in the dictionary, you're gonna see a picture of her. But what gets you really inspired is you see that she's up for growth and challenges, all to make better healthcare and services to others. And we also go a little personal. We take a twist and cover social media and our kids, also parenting, kind of get in the weeds over how we have to parent differently for each of our kids. These are all the great topics we cover and so much more. So what a way to wrap up season 2 of the Dare to Ask podcast. So let's get to it.
So my name is Kecia Lund, and I'm the Director of Women's and Children's at Essentia Health in Fargo.
Kecia.
Most people say Kecia based on how it's spelled. No problem.
With the singer.
Yes.
And no,
I'm a bit
Kecia.
older. It's Kecia.
But here's my hard-hitting question for you. Doppelganger. Who do people say you look like?
That's a great question.
Celebrity. Has anybody said? Because to me, it's as plain as the nose on my face. Your doppelganger.
Okay, in high school, one time, but this was, again, I'm in my mid-40s, so many years ago.
Hey, preach, sister.
And I had very spiral curly hair. So at the time in the 90s, someone once said I looked like Faith Hill.
Ooh.
Again, long time ago.
You know what? Kind of. Here's what, I'll just lay it on you. Robin Wright Penn, the actress.
Oh, really?
Gorgeous. Yes.
Oh, you're kind.
No, you really do. I'm almost like a little starstruck thinking, is this Robin Wright Penn across me? No, just kidding. Well, you are very beautiful and have such a warm, radiating, just the emotion coming off of your person is just so lovely. And this, of course, just screams, you're a nurse.
Oh, thank you.
It's like there has to be a gene in order to be a nurse. Do you agree? Do you feel like it's one of those careers that people will say, you have to be a special kind of person to be blank?
You know, that's a great question. So nursing for me was a second career.
Really?
It was. So I have a biology and psychology degree first.
Okay.
And then I went on and did a master's in clinical psychology because I loved the psychosocial, emotional piece of things. Yeah. So I was really fascinated with the psych of women, but I loved my science, my biology courses. And so went on and did an advanced degree in clinical psych. I loved the master's degree. I taught a little bit at a college in Iowa, and then I also worked in a hospital working with dialectical behavior therapy. So people that had some borderline tendencies and helping them out. And so at the time when I was teaching teaching, I knew I didn't necessarily want a PhD in clinical psych.
Okay.
And the nursing department was right across the hall from the psych department. And I kept thinking about nursing. And then I shadowed some nurses, and it just kind of, the light bulb went off because it was combining my biology love with that holistic view of caring for people. So that cognitive, behavioral, emotional piece, the science foundation kind of came together, and that's how I became a nurse.
Okay. The gentle way you described it is almost like by osmosis. You took a wrong turn down a hall and you ended up in the nursing portion instead of psychology. You thought you wanted to be a therapist. Mm-hmm. And then nursing started to pull on your heart.
Exactly, because it really did kind of combine all the things that I loved. And I was always passionate about women's health. Mm-hmm. Again, that Psych of Women class back in my undergrad I always loved women's health. And so when I became a nurse, I knew that was the area that I wanted to go into. And I've always kind of stayed within the women's and children's umbrella.
Just makes so much sense as to why you would be the director of nursing for women's services and children's at Essentia Health. Just a good fit, a really good fit. Let's talk about Essentia. How long have you been there?
6 years.
The big thing on everybody's lips is the huge remodel, the $5 million remodel with on the maternity floor and your NICU. Prior to that, there have been some big upgrades.
Kind of my world, I would say, for probably between 4 and 5 years. So it's been a wonderful adventure. I don't think most people can say they've been able to be a part of this many renovations within these departments. And it's been a labor of love. But it was many years of planning. I think Essentia did a wonderful job. That's the 5th healthcare institution I've worked at. And I would say I felt like the leaders and the staff and the providers really had the main say in how things would be developed and these renovations done. So we went to multiple places in the Twin Cities. Our architect came with us.
Oh, fun.
We went up to Duluth, and we just really looked at what do we love, what did we learn from those renovations at those hospitals, and then we kind of took that back and really decided, okay, this makes sense for our patients. This makes sense for our flow, for our staff and our providers. And it was every single detail from piece of equipment was decided, the head wall, the foot wall, where oxygen is placed, artwork, the colors, the flooring, everything really was the people that do the work had the say in the development. So I feel really special.
I'm a 5-star as far as what my rating is for the place because it really has been intentionally chosen down to the tiniest detail and adding that warmth quite literally and emotionally and figuratively with like the fireplaces in, the room that you're going to deliver your baby in. It's stuff like that, and really conscientiously thinking about the partners in there with mom going through her labor and delivery. But then on the opposite side of that, let's say preemies who need some NICU love for a little bit, to be able to give them their own suite and the parents truly be able to feel comfortable.
Yes. You start on the 6th floor, and I would say we really wanted to focus on a calming, spa-like environment or hotel-like environment where you walk in and it's not scary. You don't see all of this equipment. You don't see all these things that seem so foreign and might make you nervous. And it's all really hidden away so that if the nurse and the provider, they need supplemental oxygen, or maybe a mom decides she wants nitrous or laughing gas for pain, you can grab those things. Or if you need suction, all of those things are kind of hidden and we can grab if we need, but otherwise it just really feels like a calming place to have your baby. And we really tried to do an intentional space for that birthing partner, as well as if baby needs help, we have our, level 3 NICU team, our neonatologists, our NICU nurses, our nurse practitioners. There's a separate dedicated space for that baby if they need help breathing. And also the way it was built so that mom and that birthing partner, dad, can see what kind of the assistance that our NICU team is provided. So it's like at a 90-degree angle instead of 180 degrees where you really can't see from the head wall to the foot wall. So we really tried to make it a place that it works for everybody. Obviously the parents on this journey, and then for the healthcare team as well. So
you guys have done a great job. It almost makes me want to have another baby. I mean, it's that good when you are trying to decide on a provider, on a hospital, on where you want to give birth. And it goes back to the earliest relationship when you are trying to find the right fit. And you're going to be very pleasantly surprised, or not surprised at all, because you've heard us rave about it so much. Like, yep, this checks out. This all checks out. Kecia, let's talk about getting a little bit behind the stethoscope. I want to go back to when you were a little girl. Did you know that medicine was going to be in your future? I'm going to ride a unicorn, be a pop princess. What were you thinking?
That's a great question. I knew I wanted to work with people. Probably wasn't until junior high, I would say, that I thought, I think I want to do something in the medical field.
Okay. Where were you raised?
I was raised in Minot, North Dakota.
Really? Mm-hmm. So we got some roots here.
Yes.
In North Dakota.
Yes, we do. And let's see, I was a gymnast for 14 years, and I taught gymnastics to little kids. So I always loved teaching. I, again, always wanted to be around people, whether it was through just helping them kind of improve. But kids was always an important part, whether it was teaching Sunday school or swimming lessons or being the lifeguard at a pool.
You did all of that.
Pool. Oh, yes.
So where did you land when it came to college?
I ended up at Concordia College here in Moorhead, Minnesota. Mm-hmm.
So isn't it funny how home really was like drawing you? Like that must have been important to stay close by?
It was. I was the oldest child, and I think it was far enough away where I felt like I could just explore and be on my own. And I liked the liberal arts kind of background, and that I was going to get to dabble in lots of different things. But then, 4.5 hours, I could go home when I needed to.
Where did you then go for medical?
So the clinical psych I did down at Mankato, Minnesota State. And then when I decided to become a nurse, I went out to Cleveland, Ohio at Case Western.
You are not the first. I've had quite a few guests on this podcast that Ohio. Interesting. Go on.
Yeah.
I'm here
so
for it.
Was at Cleveland, did nursing school. Case Western was great. My husband, so I got married while I was in nursing school, and the long distance multi-year relationship worked out okay. But then all of a sudden when you get married and you're doing a long distance marriage, that was just, it kind of crossed the line. That was really difficult. He was looking at jobs kind of in Ohio, in Cleveland area. And he was in the Twin Cities, and I was looking at can we make that work, and nursing jobs were there were more opportunities than college administration jobs, and so I moved to the Twin Cities and started a career as a nurse in St. Paul.
All right. So you started your career as a nurse down there, and now you're married. What got you up here 6 years ago?
Yes.
To Fargo.
So, well, it actually was 2012. So and worked at a different hospital. Okay. But anyways, our alma mater actually brought us back.
Oh my gosh! So back for some Concordia love.
Yeah, that's exactly it. And we knew at the time. So in 2012, I had one daughter who was 1 and a 3-year-old, and the commuting. My husband, because I was working in a hospital, he did the dropping off and picking up, and the girls were in the car commuting with him because he was in Minneapolis working, and we lived in Woodbury. It was like 2 hours in the car. And we knew that we wanted to get a little closer to home. And so we ended up, we moved back here, and it was like the best decision we ever made. It's almost been 10 years. I can't believe it.
Yay.
Yeah.
See how it all just kind of ties together. What the heart draws you back to. Kind of funny. So how old are your daughters now? And are you just the 2 kids?
Yep, just 2 girls. Okay. So I have a 13-year-old now and a 10-year-old, Harper and Meta.
Love their name.
Yeah.
Harper and Meta. So what are they doing? Now, did they kind of fall in Mom's footsteps?
No.
Are they gymnasts?
They are not, which is okay because I kind of wanted them to do other things. So my oldest is really into orchestra, and she is part of FMAIS, so the Fargo-Moorhead Area Youth Symphony. Oh, yeah. Orchestra is just prolific, I would say, in the Moorhead Public Schools, and she is an amazing instructor. So she does that, and she takes private lessons from someone at Concordia College. So she loves that. She does swimming, and then she does some martial arts. That's very different than me. And then my younger one, and my older one's definitely an introvert. My younger one, Meta, is kind of the social bug, loves to dance. So lots of different dancing is going on right now. Nice. And choir, loves to sing. So
I love it. So we've got some physical activity as well as that whole artistic side too.
Yes. Yeah.
It's really nice. Mom and Dad, good job.
Oh, thank you. We try.
Well, and the two girls, and the fact that you have the nursing background and women's and children's, what would you say is one of your biggest challenges of raising up, especially as the girls are getting older? And now you said teenager, kind of with that shrug. Oh, here we go, teens. What's the biggest challenge of raising girls that are 10 and 13 right now?
Oh, golly, that is such a good... I did not expect I was going to get these types of questions. Oh, my goodness.
Good. I'm glad I'm springing some stuff that's really making you think a little bit.
Oh, I feel like adolescence, that 12, 13-year-old is like new territory, and trying at the end of the day to empower her to make good choices, be a strong young woman, not kind of just be overpowering, and not try and screw it up.
Yeah.
You know what I mean? Just trying to make sure I'm an okay mom, know that, she's super quiet, that introvert, and that is not me. So trying to just learn,
navigate personalities as they step into their personalities more and more.
Yeah, so keep her safe, of course. Empower her to have a strong voice as a young woman, and find her passion.
Yeah. How does she take? Because I feel like we're not yet in the. For instance, my oldest is 16, daughter.
Okay.
And when we get into that older adolescence area, we have a whole new bevy of interests, bevy of scary issues, bevy of things going on. What is going to be your approach when we start talking about that puberty and maturity and some of the things our young people are facing these days with social media? Let's talk about that. Let's talk about screens.
That is a hard one for me.
Yeah, isn't it?
Oh, goodness.
I think it's a hard one for every parent.
So with my 10-year-old does not have a phone. When Harper turned 12, she has a phone. But at this point in time, no Snapchat, no Facebook or Instagram with her. I think because I just need to navigate through that and just make sure I'm an informed parent before we go into that respect. No. So I don't know. It's
now,
new
does
to
she
me.
give you pressure, or do your kids give you pressure to have those things?
My 10-year-old, yes, absolutely. My 13-year-old, no, because I think she knows here's kind of the ground rules. Yep. Here's what we got going out. She's got a couple really close, strong friends, and I think we have very similar belief systems. Maybe the friends' parents. So, but still trying to figure out the social media. I love the inclusiveness that she experiences or she talks about with her friends and diversity. So that is good. But
do you feel like I feel, which is it doesn't feel like there is a right answer when it comes to social media and our kids. It's just so scary.
It's great, and I think each kid's a little bit different.
Totally.
So my 10-year-old is the one where I feel, and I've always known this ever since she was about 3, I'm like, she's the one that I'm really going to have to watch. And I mean, we still look through the 13-year-old's phone, and she knows that at a certain time, phone always goes in the kitchen. Yeah. And that mom and dad pay the bills, and we're trying to just make sure you stay safe and make good choices, and we're here to help you. But, I feel like I don't know what I'm doing.
None of us do, right? feel the same way. It's interesting. We kind of line up in a lot of different ways when it comes to, at least personally. We have 16 down to 6. And it's just our oldest two, 16 and 14-year-olds that have phones. Both didn't get a phone until 13. Mm-hmm. And social media, my daughter got an Instagram account for the first time last year, so when she was 15, but no Snapchat, no Facebook, and that sort of stuff, like a Pinterest and Instagram, I think. And she is past the point of putting this pressure that she needs Snapchat because we've been a hard no on that. Mm-hmm. And I think one of the benefits that we've had on our side, I've been in media forever, so the kind of stories and lifestyle topics that we cover and those news pieces and media pieces that I'm constantly reading, I always make a good case there. And then our family friends that are really close to us are also in law enforcement and children's protective services. So we come in with all this knowledge of as long as we can put this off for you, help you make that decision that it's a no, and keep some of these dangers out of your life until your maturity is at a level where, you're going to feel confident in your choices as well, and not get them muddled up with temptation and things that young developing minds, they're not seeing maybe the wrong in some of those choices because of their age. Yeah. Oh, that's some heady stuff today. Yeah.
But it is so true. I remember when they were little thinking I was worried about stranger danger or walking out in the middle of the street or choking or, ear infection, strep throat. And people would tell me, oh, wait till they get older, wait till they get older. And it's so true. It's so much more complicated. Mm-hmm.
We have that, hindsight, wow, what an ability to have, because you'll always look back and go, oh, these are the days. I remember thinking potty training was the worst, and I would never want to go back to that. You get into some of these teen things and you're like, I could go for back some, some bedwetting at night and some another dirty diaper over, this friend doesn't want to be my friend anymore because I won't get on Snapchat. Those kind of things. So it is some heady stuff. What about health and your girls? What's your approach since, you are in the field? Do they come to you with their questions right now as they're getting older? Mm-hmm.
My 10-year-old has always been curious about her body and how things work, and has no problem asking any question under the sun. So been very open, very frank. I think that's been, it's just, as a nurse, it's been fun to explain things, and also with the psych background, it's been good. My older one, I have to pay attention because it'll be, it comes not very often, right? And it's very subtle. But she will ask me, and I'll ask my husband, did she ask you about that? And he's like, no. So I'm like, okay, I know she feels safe. I know she can still ask. It's just she's much more quiet and kind of wants to try and figure things out herself. But I think she also knows when she needs to ask mom about something related, just how she's growing or changing.
Yeah. It's the psychology behind it all. From birth order, as you're discussing, to this personality, whether introvert, extrovert, and you're getting both sides of it, and just who they are as people. And it's so crazy how each kid is different. I'd been given a piece of advice long ago saying that you will quickly realize, especially when you have multiple children, how your parenting needs to change because you're really parenting differently for every child. Because what you tried with first and second born is not working at third born. This worked perfectly with the first two, and now my third, it's just it is not hitting at all, and you have to completely change course and do it all again, which is, to me, that's God's sense of humor. That's just such life. You're just constantly learning. You never have it all figured out. Even the people that write the books, they're still learning stuff too. We're all in this kind of together in this parenting journey. If you are a parent,
absolutely, and it's so true. I remember. My no meant no for my firstborn. And we live on a golf course, and there's 2 ponds. And it was always very much we never had to worry about electrical outlets, or she just always followed the rules. Yep. And then I distinctly remember moving into this house, and the 1-year-old, she might have been 2 at the time, but she knows that she can't go to the ponds. She knows like there's this divider or this little pole that sticks up and you can't go past that. And I distinctly remember watching her go to that pole, look around. I don't see anybody, and now I'm going to walk down to the pond. And again, you try to be consistent, you try to be fair, but it does look different with each kiddo. It really does. So,
and then you're like, well, that didn't work. So now I got to redirect. Refresh, hit the refresh button.
Right.
Let's try something different.
Right.
Oh, and that is so applicable in so many ways, but I like the description that you just painted there because that is a good one. And I think any parent out there knows exactly what you're talking about. Let's jump back into your day-to-day because now I'm interested. We have a little background on you. Let's talk about your day-to-day and what does it mean to be a director of nursing?
Oh, wow. That's a great question. What is really fun, and I think, my background has been labor and delivery as a nurse, and there's a little bit of, I don't know if I would say adrenaline going when you are an inpatient, especially labor and delivery, because things change. It's so fun because it's, it's 1-to-1, you're with one patient, but it's really fast moving and so on. And I think my day is still like ever changing. It's fast paced and it's different every day. I think again for the last 5 years, so much of it has been reno. But I think also over the last 2 years, it's been COVID.
Right.
So learning how to navigate through the changes with each wave, with each variant. There's just, how do we keep our patients safe, families safe, our staff, providers safe? So it really kind of depends. There are a lot of meetings, I would say, too, where you're making kind of some bigger picture decisions, but then there's also those day-to-day decisions that have to be made. So I would say current state, it's a lot of how do we make sure we have enough staff to care for our patients? How do we bring in patients from outlying communities that need that higher level of care? And again, how do we keep everybody safe at the same time has been, it's been a big part of what's been, I think, happening. And then there's, I just feel like there's always, day-to-day things with equipment and sometimes different things with the facilities. I think as the director, you also get you're what's called sometimes the administrator on call. So I've been a part of things outside of my women's and children's 3 departments, where it's been really interesting to grow and probably be challenged as a leader. Different decisions or things that, the house supervisor will call you on, after hours, say, okay, I'm not sure. I'm stuck here. What do we do with this? So,
Which I can only imagine, if I'm being presumptuous or not here, but I can only imagine that with a pandemic, it's only grown that exponentially. Just because here you had intentionally cast your net wider, going outside of labor and delivery nursing. And now, like you said, the 3 departments when, it is women's services, it's NICU, and it's the birthing center. Okay, so now in this administrative role to get these other phone calls on top of a pandemic, you've got quite a few hats.
Yes. The nice thing is, I would say, Essentia does a really good job where you can phone a lot of friends. Phone a friend is something that we do a lot. And I've got a great group of provider leaders, nursing leaders, facility leaders. They're all on my cell phone. And, it's just nice to know you're not alone. And I can always call in reinforcements. So I feel like I make the right decision for our patients and families and staff.
Kind of nailed a common thread that I've seen, not just as a professional partner, but also as a patient, somebody who takes all of my children. I go to Essentia and have now for 7 years. I've seen it firsthand, and the common thread is team. Just mentioning the catalog on your phone and who's your go-to, and having, the people that you can call and talk to and work together with and problem solve together. That's that team approach. And it's one that's so approachable. What I've learned, specifically from a patient perspective. being in a situation where, this person is on call, but a regular person that I see, provider, isn't, but knowing that they're communicating, hearing firsthand, seeing the results of that communication, and just truly feeling like I'm a part of this. Like I'm submitted.
You're at the center
I'm
of it.
part of this, and it feels really good because it makes me feel, and then my children in part, very taken care of, very looked after, very welcomed and warm.
Oh, that's wonderful to hear. I will say of, the 5 healthcare institutions I've worked with, again, I just feel like, every decision that is ever made, the patient is always at the center of it. And I'm not always going to agree maybe with my physician leader colleague, but I do think we have a culture where we can come together and say, okay, let's huddle here. Let's figure this out. Let's bring everybody involved that touched this patient, and let's figure out what is best. Or, and that's not always the case. So, you can be vulnerable. You can say, I don't know. Let's come together. So I feel really privileged to be able to kind of grow and lead at Essentia.
Wisdom as women in our 40s, the things that we learn, right? To me, the word and the action of this emotion, vulnerability, has grown to mean something so much more than what I used to define it as. Vulnerability used to be weakness. And now, to me, especially over the last 3 to 4 years, has just proven how it's strength. It's truly strength, because there is, to me, nothing better to be on a team where you can have a safe space to be vulnerable and show, okay, here's an area where I feel not confident, but I'm sharing it because I know that I won't be judged, or I will be helped through to make me stronger. That's incredible.
Yeah.
That's incredible.
I agree.
I love that you use that word. I love that you are showing evidence of a practice where, you can have the safe space to be vulnerable, to learn and grow, to evolve.
And I think as a 20-something and 30-something, I definitely wasn't there. Or like you said, it was maybe, I got to figure this out. I got to know the answer, and now it's, just, when we have meetings every day, like with my supervisor or managers, we come together, whether it's a staffing concern, doesn't matter. But there are multiple times where I'm like, well, I'm not sure. Well, let's come together. Let's figure out what we think is the best choice for, this moment in time.
Let's collectively
make a decision on the information we have here now.
Lead me into my next one. You've heard the phrase maybe, the future is female. What is your feeling on that? What is your feeling, healthcare and women? In a practice of authority, or in a position of authority, what's your feeling? Do you see more and more women filling roles that have been typically filled by men?
Sure, or that's a great question.
What do you see even in the next 5 years within the healthcare community?
Within healthcare. Well, I think what has been fun is I have a great dyad partner and several physician leaders who not just oversee women's and children's, but oversee multiple departments within the hospital, and very strong female leaders in these roles. So I think it's great for role modeling. I think women need to be at the table. And I also think what is also fun is I have learned, when I was in Cleveland, one of the best labor and delivery nurses I learned from was a male. So how do we incorporate in our NICU, we have one male nurse, and he gets more compliments than almost anybody. But how do we get bring in some diversity in maybe some areas that are typically maybe our female nurses have been kind of drawn to. But then also making the big decisions throughout this institution. How do we get more females involved? And I think Essentia's done a really good job with having female leaders at the table to make those decisions. So I see that continuing, I guess. And growing even maybe more so.
Well, it takes a long time for outsiders to start start seeing that too? Do you know what I mean? Like, I'm putting myself in this category, and I've been seeing it. So the point is that those are changes that don't happen overnight. You really, again, it goes back to intentional choice making and that growth. It usually takes a very long time. So already the table being set, filled with female role models, that excites me. That's one of the reasons why I was so on board with this whole podcast, because all of my guests thus far have been women providers through Essentia, and the bevy of new information that I'm garnering, but also just, making decisions collectively, and instead of it's always a competition and I want to put two women against each other. No, there can actually be two seats at the table, not just one for a woman to compete with another.
Yes,
but
absolutely.
We're making room for everyone, and that diversification and quality that I see, that excites me about where the future keeps going, and why I like the phrase, the future is female.
Yeah.
Not to cut out men. I love you too, guys. You have been a delight today. Is there anything that you would like to talk about that we haven't covered yet? Because there is one other question I really have for you. But if you have any topics that you'd love to discuss with me, use this as a platform, because we can talk it out.
Well, I think, you have brought up the newly renovated space. I'd like to maybe just talk a little bit about that, and the NICU too, just because really it was the same process with our amazing NICU as well. So, when we started in the birthing center, you mentioned the fireplaces, and we have these family convenience fridges, and again, a space for, whoever that birthing partner is, to their intentional space, the desk, the couch that turns into the bed, laboring tubs, and so on. And then really that the family unit stays in that room the entire time. I think that's something that our patients had asked about for quite some time. They really like to not have to move, 2 hours after the birth, which is typical with larger facilities. Is once we know mom and baby are stable, it's been that 2 hours, and everybody is doing great together. Then we move them to a postpartum room, and it's typically a med-surg standard patient room size, and how it's just so much nicer, I think, for that family unit to stay in a birthing suite.
I agree, and it could be really subtle. You're not even thinking about how nice it is until you've actually had your time there, you've checked out, and really realized, wow, how comfortable in forming the bond with your infant, and just the recovery process. Like, how comfort is truly at the heart of all of those things.
Yeah, and not having to, after you literally just kind of take a breath, and it's been 2 hours, and now you have to pack up all your stuff and move. But I think, also with that, knowing, there are times, for example, we have a preterm baby. So in the NICU, we take babies that are viable on up. So really, really preterm, 23 weekers on up. And we also felt is super important when we know those babies are going to be in the NICU, and our NICU's on our 4th floor, not our 6th floor anymore.
Yep.
That we want moms to be as close as possible. So we do have our pediatric unit as well as postpartum rooms. So we put our moms intentionally as close to the NICU so that, she can go in there as, literally right away, as soon as she can. And then those NICU rooms, again, also were developed by the neonatologists, our nurses, head wall, foot wall. And those NICU nurses, I would say, are the most amazing nurses, and are very passionate about the babies that they care for. So every detail matters. And we really have, they're large private rooms, 14 private rooms. And there is a dedicated family space, similar to like on 6th floor, where we have those sofa sleepers, there is a desk area, closet, there's a space for them. And then of course there's the baby care space as well. So I just think, it was really fun. That's been now 2 years already, but it's been a really wonderful journey to try and support families, whether they're able to stay in the birthing center or those babies need a little extra help in our NICU, that we tried to make it be kind of the best kind of holistic environment. The NICU is very similar, I would say, themed with kind of the artwork. We went with a local artist, and they really designed kind of the calming environment, but they've got little kind of playful pieces of art. So, it's a lot of nature scenes, but there might be a little ladybug or a butterfly kind of in that artwork, just to kind of, just help with that healing environment and a kind of calming space.
Even the tiniest details that are intentionally made to help uplift and help in that recovery process and just making it such a warm environment. I believe now, is it not in the NICU suites that there is the partition curtain too to help with privacy?
There is. Yep. Each room has again, and you can see the marcation in the floor. But when families just need kind of some quiet space, they can take a breather. They can pull the curtain and just kind of have some space where they're not maybe seeing the nurse continually,
or just even the privacy behind new mom, oftentimes unable to physically breastfeed yet, but wanting to pump, wanting to keep the milk up. Again, there is why you have that personal little refrigerator. You have the partition if you want the moment for privacy to do so. It's those kind of things, like all levels, been thought about.
Yeah, absolutely.
But you guys have done such a great job with your website and immersing that three-dimensional video so you can take some virtual tours to really get to see what it's all about prior to actually being admitted. So you guys have done such a great job. I know that you can go and find them online to be able to get that little peek behind the curtain.
Yes, absolutely. You can do that for a birthing center room, one of the suites. And then also you can take a tour of our level 3 NICU as well and go into a room and look at all the specific details of what a NICU room would look like.
Thank you so much. Today has been wonderful. I'd love to have the final little nugget I have is a wellness nugget. I'd love to know what are some things that you do that you think, hey, this is something I can't stop doing, or I can't live without this.
Okay.
It's okay if you say coffee. I get it.
I do like my caffeine, as you can see as well. For me, and probably over the last 20 years, yoga has been my place that I go, especially probably over the last few years. But even kind of going back to the rudimentary, just breathing. And I think yoga does a great job of teaching you that, because it's all in your breath. So whether it's something super stressful at work or at home, I always try and come back to the breath. But yoga is my salvation.
I love that.
So,
I feel like we're always looking for the next great thing. What's the trendy thing? What's the thing? What's the thing? What's the thing? Even in where we're at with putting mental health so much at the forefront and practicing mindfulness and, these good coping techniques that seem to be a lot of the buzzwords these days, especially for women's health. But, yoga has been a practice where mindfulness and being in that present moment and focus on things like your breath and your body and being able to release, thoughts and images from your mind. So you're bringing back to center literally decades. Centuries? I mean, yoga's been around for a very long time, but even, modern yoga these days, decades, where, you can tap into some of the stuff that still works, guys.
Very true. I remember when I was in labor with my first, and I had done some different classes, and I was a labor and delivery nurse. I'm trained in this. And I remember thinking, when I was going through things, I just got to breathe, and how it really came. And then the realization is I'm just doing my yoga breathing. That is the only thing that's getting me through this right now. So,
isn't that incredible? But it's so true. Well, this has been a delight. Thank you so much for coming on
for
and
having
being
me.
my guest today.
Thank you so much.
It's been a treat. Thank you.
Thanks.
Kecia Lund, what a girl boss who absolutely inspires. She is just the perfect bookend to season 2 and the Dare to Ask podcast. This has been such a treat to have another huge lineup of most amazing women who are providers in our area right here. And I've learned a lot. Another season of learning a lot. I can't wait to do it all again. All of my wonderful guests on this season of the Dare to Ask podcast. Where you get your podcasts, you can also go to Essentia Health's website and find them all there as well. Look on YouTube. Again, Thank you. Thank you so much, ladies, for joining us.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Ashley is full of stars, stripes, and spectacular home savings. Give each room of your home a summer refresh and save 20 to 50% off. Plus, get 5 years no-interest financing with no minimum purchase. Start the best rest of your life with Purple Mattress and save up to $500 off select adjustable sets. Plus, get 15% off Purple accessories. Find spectacular home styles with stars and stripes savings. Happening now at Ashley. Financing is available with approved credit on qualifying purchases. Ask store for details. Ask store for details. Ask store for details. Ask store for details. Ask store for details.